Zerviate 0.24% eye drops in a Dropperette Ophthalmic Antiallergic agents is used to prevent itching of the eyes caused by allergies. The active ingredient, cetirizine, is an antihistamine that works by blocking the natural substance histamine, which causes allergic symptoms. It's important not to use this medication to treat red or irritated eyes from wearing contact lenses. If this happens, it's best to contact your doctor for further instructions. For daily usage, it's recommended to use 1 drop in the affected eyes twice a day, with 8 hours between doses. The best time to take this medication is in the morning and in the evening. Remember to wash your hands before applying the eye drops and to avoid touching the dropper tip to prevent contamination. If you wear contact lenses, it's advised to remove them before using the eye drops and wait at least 10 minutes before putting them back in. The medication should be used in the affected eyes as per your doctor's instructions, typically twice a day, with an 8-hour interval between doses. Before applying the eye drops, make sure to wash your hands. To prevent contamination, avoid touching the dropper tip or letting it come into contact with your eye or any other surface. If you wear contact lenses, remove them before using the eye drops, and wait at least 10 minutes before putting them back in. Do not wear contact lenses if your eyes are red. Only open the single-use container right before you are ready to use it, and discard any remaining contents after use. To apply the eye drops, tilt your head back, look upward, and pull down the lower eyelid to create a pouch. Place 1 drop into the pouch as directed by your doctor, then close your eyes and apply gentle pressure at the corner of your eye, near the nose, for 1 to 2 minutes to prevent the medication from draining out. Try not to blink or rub your eye. If you need to use the medication in both eyes, repeat these steps for the other eye. If you are also using another type of eye medication, wait at least 5 minutes before applying it. Use the eye drops before the eye ointments to allow the drops to enter the eye. Consistently use the medication at the same times each day to get the most benefit from it. Do not use the product if it becomes contaminated, as this can cause infection, serious eye damage, or loss of vision. Contact your doctor or pharmacist for more information. Inform your doctor if your condition does not improve within a few days or if it worsens. When using Zerviate 0.24% eye drops, you may experience mild and temporary burning or stinging of the eyes. If this continues or becomes worse, it's important to let your doctor or pharmacist know right away. It's important to remember that your doctor has prescribed this medication because they believe that the benefits outweigh the potential risks. While many people using this medication do not experience serious side effects, it's still important to be aware of the possibility. While it's rare, a very serious allergic reaction to this drug can occur. If you notice any symptoms of a serious allergic reaction, such as a rash, itching or swelling of the face, tongue, or throat, severe dizziness, or trouble breathing, seek medical help immediately. It's important to note that this is not a complete list of possible side effects. If you experience any other effects not listed, it's important to contact your doctor or pharmacist. As always, if you're in the US, you can call your doctor for medical advice about side effects, or report them to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects, or report them to Health Canada at 1-866-234-2345. Before using Zerviate 0.24% eye drops, make sure to inform your doctor or pharmacist about any allergies you may have. This medication may contain inactive ingredients that could cause allergic reactions or other issues, so it's important to discuss this with your pharmacist. It's also important to inform your doctor or pharmacist about your medical history before using this medication. After applying these eye drops, your vision may be temporarily blurred. It's best to avoid driving, using machinery, or doing any activities that require clear vision until your vision has returned to normal. If you are planning to have surgery, make sure to inform your doctor or dentist about all the medications and products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, this medication should only be used if clearly needed. It's important to discuss the risks and benefits with your doctor before using this medication. It's not known if this drug passes into breast milk, so it's important to consult your doctor before using this medication if you are breastfeeding. When using Zerviate 0.24% eye drops in a Dropperette Ophthalmic Antiallergic agents, it is important to be aware of potential drug interactions. These interactions could affect how the medication works or increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Always consult with your healthcare provider before making any changes to your medication routine. If this medication is swallowed, it can be harmful. If someone has taken too much and shows serious symptoms such as passing out or having difficulty breathing, it is important to call 911. Otherwise, contact a poison control center immediately. For U.S. residents, the local poison control center can be reached at 1-800-222-1222. Canadian residents can call a provincial poison control center for assistance. It's important to remember not to share Zerviate eye drops with anyone else, as it is prescribed for your specific condition. Additionally, it's a good idea to talk to your doctor about additional ways to alleviate your symptoms, such as using cold compresses, lubricating eye drops, and avoiding allergens that may trigger your allergy. These measures can help to further reduce discomfort and irritation in your eyes. If you forget to use a dose, use it as soon as you remember. If it is close to the time for your next dose, skip the missed dose and use your next dose at the usual time. Do not use double the dose to make up for the missed one. When storing Zerviate 0.24% eye drops, make sure to keep it at room temperature and protect it from light by keeping it in the original foil pouch. Avoid storing it in the bathroom and always keep it out of reach of children and pets. When it comes to disposing of the product, do not flush it down the toilet or pour it into a drain unless directed to do so. Instead, properly discard it when it is expired or no longer needed by consulting your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.